I'm Brian Agaba. I'm an ENT and cleft surgeon here in northern Uganda. Today we just operated 2 children with clefts. Okay, that is a cleft lip, one with a cleft lip, another with a cleft palate, and this, I believe, is going to change the families, these 2 families, and maybe also bring a smile back to them. I know they have been actually wondering what could be done to help these children live better or even maybe have a better future. But this happens to many other children across the region. The burden of clefts in this area is not known because most of the time, most of these kids are either in hard-to-reach areas, even the ones who can be reached sometimes because of the social beliefs in our communities, they tend to fear to bring out these children to be helped. But the estimated prevalence still remains at the global average of 1 in 1,000 children born. But in our area, still, we believe that this is much worse than that. The biggest issue is that still, even if these kids are there, they are never helped in time. So this challenge still continues. Even some of these individuals show up in adulthood for the surgeries. The biggest challenge which we have in the region is actually access. Access in terms of the personnel who have the skill to help these children to operate these children such that they can also have a smile like any other person, and also maybe improve their speech or even feeding abilities when you have these clefts actually. The other is also the facilities which have the equipment offer these life-changing surgeries. Is also another issue. The other also which comes in is the cost attached to getting these services. We know that most of our people here are really living below even the poverty line actually. So for that reason, many of them cannot afford the service. So even what we are doing, this is sponsored surgery, and we thank our sponsors for coming in to help such underprivileged children. The other issue is, like I said earlier on, is about the social belief. People believe that this maybe if someone is born with this, it's a curse. So some children are just left to die in homes, and sometimes some of these parents don't even believe that there is something which can be done to change this. So it's really a big challenge that we have to move around there, educating the community, look for these children, and promise them that we can have this changed through surgery. Sometimes it is a bit hard to convince these individuals.